Hi, I'm Karen, and today I'm going to give you a little demonstration exercise class that you can do yourself. I'm a farmer and a physio. Recently the cows pulled me in two different directions and I hurt my sacroiliac joint, so I'm still recovering. So this class is for people who have back pain and are wanting to still get moving. The exercises are also things that you can do yourselves and see how you're improving. Sometimes you have pain in your back and it feels like it's there forever, but you don't notice that you're actually able to do more things. So in this class you'll do a few things, and every day as you do them you might notice that you're doing better or more or bigger, and that's one of the signs of improvement. Also, doing these exercises helps you to regain that range of movement, the ability to move as far as you can, and as well as the strength and the ability to control that movement. So that's important. Once you've been injured, sometimes the pain goes away, but you carry on with dysfunctional movement. You stay stiff and you don't even notice that you can't move in the way that you did before. So I hope that you enjoy this. I'm going to give you some interesting backgrounds as distraction. Don't get distracted by the animals, although they're very lovely, and try to do the exercises yourself. Thanks. Your spine moves forwards and backwards, so bending forward and leaning backwards. Often one of the things that's very uncomfortable to do is to come back up from bending forwards. Your spine also shifts to the side and shifts to the side. So this is one of the things you can do at home. Stand, put your legs a little bit apart, and then just slide your hips to the side and slide your hips to the other side. Sliding left, sliding right, sliding left, sliding right, sliding left, sliding right. If it's uncomfortable, just go as far as you can. You don't have to make your back sore. The idea is to regain that feeling of that movement as you do it. Left and right, left and right. If you're feeling like you want to challenge, you can add a belly dancing technique. The belly dancers try to do a figure of 8, so you lift up the one side and you draw a loop with that and you end up doing a figure of 8. This can be quite uncomfortable as you shift to the side, so just do as much as you can. If you can't do the full figure of 8, just try up and down, up and down. Other side, up and down, up and down. And if you are recovering from an injury, you'll find one of them feels stiff or difficult to do. For me, it's quite hard for me to drop this hip down. So up and down, up and down, up and down. Then you do the full figure of 8, up and down, up and down. I'm sure you'll be better at this than I am. You can also do a figure of 8 laterally. So this hip goes forward and then backwards. Rocks, come here. Forward and back, forward and back. And here you might also find that some of them are a little bit uncomfortable. Do as much as you can without discomfort and try to get into the pattern of the movement. When you've hurt your back, often the muscles on the inside of your thighs get tight, and stretching them helps. You might not notice it, but often when your back is injured or sore, you can't use the muscles efficiently and you end up doing other things. So try put your legs apart and then gently go to the side to stretch out the inside muscle. Don't feel like you have to go like an Olympian. Just go as far as you can, that's comfortable, and you should feel the stretching feel. It shouldn't be uncomfortable, just feel a stretch. You might feel discomfort in your back, as I do when I go right. It's a bit uncomfortable, but it's not too bad, and I don't get that feeling of spasm, so I'm not doing too much. So stretching your legs out to the side, stretching out to the side. Go as far as you can, hold it for 10 counts, 10 seconds if you can. Please stop biting me. And hold it till you feel the stretch, and you can repeat that 3 times. Another thing to do in this position is squats. Rocks. Squat and up. It's good to use your bottom and up, especially if you can't bend forward very far. This is a nice way to get the muscles around your pelvis and your lower back to work without getting into a painful position. If you have a small, annoying guardian dog to pet, it makes a good distraction for her. Squatting and up. Using the big muscles is always good. One for fitness and strengthening. And these muscles are really good and important to do to maintain your balance. Guardian dogs shouldn't chew your gumboots. It's important to get your back to bend backwards again, but also using your glutes, your bottom muscles. So you can hold a chair and then take your foot behind you just to get the muscle to work. Take it behind you. If you're feeling like you're strong enough, you can lift your leg up like ballerinas do behind you. You might find this is difficult, especially if you haven't got enough extension in your back can't bend back easily enough. So just go as far as you can. Even if you're taking your foot behind you, you're still using your bottom muscle. Take it behind you. Remember, do everything you can within the pain you have. Don't do something if it's painful. Do it up to the point where it's comfortable, and then tomorrow you can try again. Taking your foot behind you. Taking your foot behind you. If you're feeling strong, take it behind you and lift it up. Sitting and bending forward is often quite uncomfortable. Sit on your chair, put your hands on your knees, and just practice bending and coming up again. Bending. If you're feeling like you can, eventually you should be able to bend your back right down, and you could feel a stretch. Just be careful not to do this too soon if your back isn't allowing you to do the stretch and recover enough. In the early stages of hurting your back, in whatever you get a whole variety of injuries. Obviously this is a very generic video, but usually you'll find sometimes it's not painful to go forward, but it's painful to come up. Ask your physiotherapist if this is something that you can do. Otherwise, just try and see how it feels when you come up. You should be able to come up to completely straight. But as you recover, you should be able to get that movement back, that you can go forward and give it a decent stretch. You must listen to your own body. It'll tell you if you've done too much or too little. Also, in this position, you can practice tipping your pelvis forward and backwards. As I said, as you recover, you should be able to regain all of the movement that you had before and all of the positions and be able to regain control of those things. So practice tipping forward. Tipping your pelvis forward is often a bit uncomfortable. Make sure you're not sliding your body forward and translating this way. Keep your body upright, tip your pelvis forward, tip it back. As you're recovering, you'll feel like you can do more of these things. Forwards and backwards. Forwards and backwards. Feel for yourself what it feels like when you do it, and make sure you're not making it painful, but that you are regaining the movement in the pattern. In this position too, you can practice pushing against the opposite hand. You want to get the muscle sling that goes across your body. We have a lot of reciprocal movement. Pushing on your knee, lifting your knee up and pushing against your hand. Feel this muscle connection here. Feel the rib on the opposite side pulling down towards the opposite hip. Lifting up and down. Opposite side, lifting up, push against it and down. As I said before, you'll feel that one side feels surprisingly weak and unable to do it. Just keep trying, and hopefully over time you'll feel that you regain that ability to work equally powerfully on the left and on the right. So this hand is pushing down and this knee is pushing up against it. The other thing you can do in this position is hold onto your knee and push your knee away from you. Feel for yourself which one's uncomfortable and which one's not. Pushing your knee down and away. Pushing your knee down and away. Try on the right hand side. Pushing your knee down and away. Pushing your knee down and away. Pushing your knee down and away. Reaching forward. If you have a counter stroke, sitting back. Reaching forward and back. Reaching forward and back. Maintaining flexibility in your spine is also really important. You can either do it by just rotating, rotate to the right, rotate to the left. See if you can feel where the movement happens. Sometimes part of your spine is very bendy and flexible and some of it's not. See if you, as you twist, feel where the bend happens. If you're feeling discomfort, don't push into it, Feel where it's uncomfortable. See if you can adjust the movement slightly, shifting a little bit this way, a little bit that way, turning a little bit more, using the muscles in your sling. You can also add a forward bend. This is quite an extreme exercise for people who have back injuries that are acute, so don't feel like you have to push it, but if you can, ultimately you should be able to get back to doing a twist and a bend. For me at this stage, it's quite uncomfortable to go so far forward, so I'm just going to try to do a little bit and then come up. A little bit and come up. A little bit and up. Hello? You can also do it like this, stretching laterally, so getting that glide back. Much as we did in standing when you're shifting your hips, you can do it just stretching to the side and stretching to the side. Excused. You'll notice that sometimes as you go to the side, you might arch your back or tuck your tail in. See all the different positions and how you do it. The best way to do it is the way that makes all the muscles able to work optimally. So if you're arching back, these muscles in the front aren't getting much of a chance. If you're tucking under, the back muscles aren't really working. So try find that middle position that you can shift to the side. Both sides, the front and the back, are able to work. Shift to the side, 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 shift to the side. It's a nice way to get a stretch, but it can be quite uncomfortable if those joints aren't loose enough yet to be able to facilitate that movement. So as I said before, do what's comfortable, and each time you do it, see if you can gain a little bit more. If you can get back to the point where the left-hand side and the right-hand side feel like you're able to reach the same amount of movement. Despite having pain in your back, there are things that you can do lower down too. Raising your heels or standing up onto your toes helps to activate the muscles along the back of your leg. So practicing just doing heel raises. You can't see so clearly in my gum boots, but going up on your toes, hold onto a chair if you need help, and down. You can do one side and then the other side, leaning over left and right. Left side, right side. Your body likes to work with a whole bunch of muscles together. So if you can get them to work, then you might find that the muscles that have been injured are able to reactivate again. Left and right. Try the same thing on your heels, lifting up your toes in the front. Rocking back to lift up your toes in the front. Rocking back to lift up the toes in your front. Another thing that's quite nice to do in this position, holding onto the back of the chair, also reaching up with your arm. As you reach up, you can stretch out the muscles on this side. As you want to expand the exercise, you can reach up and reach over and back. Don't forget, it's not just the stretch, it's the ability to control the movement with the muscles that both lengthen and then shorten as you come back up again. So reaching over to stretch and then coming back. Reaching over to stretch. I would recommend that you did only a few of these exercises in the beginning and wait and see the following day if you feel like you've done too much. If you have done too much, you'll find pain the next day. The ideal is that you might feel a little bit of discomfort or stretching on the day that you do them, but the next day you don't feel like you've done too much. So use that as your gauge. You can make the stretch slightly more extreme. You reach up and over, and then you stretch forward. Ultimately, you want to stretch down to your foot. It's a bit beyond me at the moment. Reaching down to stretch down to your foot, you'll get a strong stretch all the way through. But in the beginning, reaching over is fine. You could expand it to reach over and reach forward and back. So start small and slowly increase it. Ultimately, you want to be able to get to the place where you can do all of those movements and even possibly more than you did before, as you gain strength and flexibility through doing the little exercises each day and noticing how you progress to be able to do more, further, or more repetitions as well. Let's do the clock. This is a balance exercise. You're going to stand on 2 feet, try balance on one leg, and you reach forward to 12 o'clock, to 6 o'clock, to 12 o'clock. Put your arms out if you need to balance. 6 o'clock, 12 o'clock, 3 o'clock, 9 o'clock, 3 o'clock, 12 o'clock, 6 o'clock. You might find as you do it, the leg gets tired, or you might feel that your back gets tired. That's totally understandable. As you've injured yourself, your ability to endure positions is going to be poorer than it was before. Try the other leg. 12 o'clock, 6 o'clock, 9 o'clock, 3 o'clock, 12 o'clock, 6 o'clock. You might also feel as you do this exercise that attaining one of the positions is quite difficult. You might feel as you stretch across, you feel a bit of a pull or a stretch. That's fine too. Just don't do it if it's too painful, and try it again tomorrow to see if you're getting better. Injuries, as with ankle sprains, need time to rest and heal. So doing exercises is possibly more than they're used to doing. So just do a few. You don't have to do many, you can do 1 or 2. Either way, this is helping you to regain your ability to balance. Balancing requires the ability to have good feedback from your leg, but also good feedback from the muscles to be able to work together. A little bit of tweaking here, a little bit of activating there. Arms out. Try some other numbers. 2 o'clock, 7 o'clock, 2 o'clock, 11 o'clock. If you want to have unpredictability, you can ask somebody in your household to just call out the numbers for you, and then you have to practice that way. If you've had a back injury, I'm sure you understand the difficulty of putting your socks on or stepping up. This step is a bit high. I have recovered enough to be able to get there, but you might find a smaller step is easier to begin with, even one book. Practicing lifting one leg requires standing on the other leg and lifting it, and your pelvis actually has certain amounts of torsion. There are 2 pieces to your pelvis, so one goes forward, one goes back, and it's that ability to move nice and smoothly that's important. So find a step or a book, and then practice just lifting your leg to put it on and take it off. You might find it's uncomfortable as you lift the leg, or you might find it's uncomfortable to stand on the opposite leg. Either way, see if you can do it on a low enough surface to be able to get that movement back. As you improve over time with healing, you might find you're able to step up higher. But in the beginning, just put your foot on it. You can also lean forward onto that leg to put pressure through that foot if you would like. Forward, put pressure on the foot. This exercise is a little bit difficult if you have a lot of stiffness and pain in the initial stages, but as you progressively improve over time, trying to get your foot onto your knee and stretching out the lateral side of your hip and your bottom. So putting it up there, even if you just put it there and rest until your muscles can relax and stretch. Hold it for 10 counts, 10-second hold. Try to do it for 3 times at least each side. Trying the other side. You'll find different sides are able to do different amounts. My left side is much stiffer than my right. It's slower, needs a bit more help, but I can get it there. If you're unable to get it in the sitting position, which is already quite a big stretch, try it lying on your bed. When you've been busy and your back has become tired, or your sacroiliac joint, or then lie on the bed, and as you lie there, see if you can give it a little bit of stretch. Put it onto the other knee and try pull it up. To increase the stretch, you can bring your leg over, or to change the stretch, and try get your knee to come to your opposite shoulder, pulling up on your knee and trying to keep your leg turned out by pulling on your foot. You should feel a stretch laterally and around. If you're feeling any sharp pain or catching, then the muscles might be too tight to allow the movement to happen at the smaller joints. So don't push it. Try do a smaller stretch until you can do that comfortably, and then progress it. As with the other exercises, you might find the one side's tighter than the other. Use that as a comparative for yourself. Try and increase the stretch on both sides and feel that feeling when you can get both sides equal. Then you'll get that feeling of balance again, that your right side and your left side are able to move equally greatly, as well as having equal amounts of control and the ability to do them. In sitting, you can also stretch your hip up. This also can be done in lying. It's nice to do it in lying. If you lie down, pull your one leg up, stretch your other leg out along the bed to increase that distancing between your hips, between your legs at the hips. Oftentimes you might find that as you stretch it up, it's fine. As you release it down and the requirement of your body is to work to control that muscle, you might find it difficult to let it down. Having a flexible spine, having flexible hips, having strong quads, and having a decent amount of balance is really important to preventing falls as well. So having a spine that is in a neutral position, able to move in different directions and rotating, and having the strength to be able to control those movements is what helps you not to fall. Improving your balance is important. This is quite an extreme activity for people with back injuries, at least, not for extreme sportsmen. But trying to get your leg up behind you, balancing on one leg, opening your arms, you have to have the range to get your leg up, you have to have the balance on that leg, and you have to have the ability to extend your lower back. So give it a go, work towards it if you can. On your left side, you can hold onto a chair or pole, putting your leg out, and get yourself going in an aeroplane. Balance. Count how long you can stand on that leg. Feel what it feels like when you come back. Was it too much? Maybe don't do that so soon. Leave it for a couple of days' time. Try the other side. Leg out, leaning forward, arms out. As you work, you might feel it's uncomfortable as the muscles that have been irritated and possibly inflamed have to work again. Feel if it's just that feeling of them working again, or if it's a catching, sharper pain, in which case it's too soon. Leave it until the future and then try to get back to it. You can do it in small amounts, getting one leg behind you, just standing, putting arms out, lean forward a little bit. You don't have to get the full airplane going. As you can see, I'm better on my left, although that's still a bit uncomfortable. On the right, I can do it, except getting my left leg is uncomfortable up as well. In everyday movement, you very rarely just tip your pelvis. However, it is important to be able to do that. Moving your pelvis means having the ability to have the range to do it, but also having the muscle strength to be able to pull up and tuck your tail under. Like a naughty dog, if you shout at it, it runs away, tucks its tail under, goes and runs away. So being able to tip your pelvis down at the back and up at the front, and then also to be able to arch your back at the very bottom, not arching your back high up, but being able to tip here. If you've had an injury, and I can feel with me now, you'll find it uncomfortable to activate the muscles right at the bottom, not arching here, arching lower down. Often that's one of the things that people struggle to get back, because you've hurt your back going forward, and then you end up kind of getting better and end up tucking your tail underneath and not getting this normal curve back. So try and lengthen out the front and just get a curve at the bottom there. Feeling like you're getting pulled in a long direction, in a vertical direction, sometimes helps to get the right muscles to work. And as it's initially sore, you'll find it hard to do this, but as you get better over time and as the inflammation and swelling settles down, you'll find it easier to do. So finding a flat piece of ground, tucking under is often easy to do when you've had an injury, because often they're flexion related injuries, but arching back and getting that low arch is sometimes a bit tricky. So try it when you're standing, tucking under, use the muscles, pull up, and then arch away. Make the arch at the bottom. It's almost like using your tail just to stick out a little bit and getting that movement back. Using the muscles. You can put your fingers on the back and you can feel those muscles working. Sometimes you'll feel one side working and not the other. Trying to get that low arch back. Not the high arch. This is easy to do. I can arch my back here and this bit remains flat. You're wanting to get your ribs to slide down and your tail just to tip out a little bit at the bottom. Do what's comfortable, don't push it too hard, and remember it's a series of improvements. So do a little bit, and then tomorrow do a little bit more, and see if you can get that back. When you can get that arch back, you'll find it easier to do things like taking your leg behind you, or taking this leg behind you, or lifting up into the aeroplane. This exercise is nice for getting those reciprocal muscles going, as well as your pelvic floor. Crossing over your legs, you can rise up on your toes and down. Rise up on your toes and down. Try crossing the other way. Rise up on your toes and down. Rise up on your toes and down. It's nice that you can put your arms above your head, reaching up to the clouds and down, reaching up to the clouds and down. Crossing the other side again, reaching up and down. This requires a little bit of balance, but it's quite a comfortable thing to do if you're feeling insecure in your lumbar spine, your lower back. So when you hurt your back, often it's difficult to bend forward. People end up squatting, but doing a full low squat is also difficult because you need to get your pelvis to tuck under, your sacrum to tuck under, and that puts your back on a big bend. So try and open your legs a little bit, squat down as far as you're comfortable going. See if you can test yourself. How far down can you go? Can you go all the way down and all the way up? You might find in the beginning it's easier to keep your back straight, but if you can, bend all the way down and then bend forward, touch the ground. Don't do this too quickly after you've been injured, because you'll find it difficult to come back up again. So low squats, keep going down as far as you can, and if you can, go all the way to the bottom, touch the floor, and all the way up again. Throughout this video I've talked about back injuries, but a back injury is a generic term and there are lots of more specific diagnoses. If you are struggling, ask a physiotherapist to assess you. They'll find out exactly which part of your back is injured, and the exercises that they apply will be much more specific. This video was really about a generic thing that you can do, also evaluating yourself. You can feel for yourself if something is too much or too little. Also, you could try these things when you see the physiotherapist. You can say, the thing that hurts it or the thing that I find most uncomfortable is this thing or that thing. It's often very helpful to have somebody put their hands on you and help the stiff part of your back to move and regain that flexibility that then you can continue through exercising on your own. I hope you've enjoyed this video. If you have enjoyed it, feel free to share it with other people. If you subscribe, then I get the message that you're enjoying it and we can make more similar to this. This is Karen, a farmer physio, and the animals of Heartwood Homestead, signing off.